Hello dear doctors, here we are going to explain next question about cardiology. A 40-year-old man was brought into the accident and emergency after being hit by a vehicle. He sustained trauma to the chest, his neck veins look distended, and his heart sounds are faint. He has a blood pressure of 80 on 45 mm Ag and a pulse is 120 beats per minute. His trachea is central. What is the single most appropriate management? Okay. A. Chest drain. B. IV fluids. C. Pericardiocentesis. D. Large bore cannula into the second intercostal space in the mid-clavicular line. And E. Blood transfusion. And we'll evaluate it. The patient had a car accident to his chest. His blood pressure is 80 on 45 millimeter, and his tachycardic pulse rate is 120 beats per minute. Okay, the trachea is central. The trachea, it means that the patient has no pneumothorax or hemothorax because his trachea is central. And here we are suspicious to cardiac tamponade, and the treatment for cardiac tamponade is pericardiocentesis, and we will explain there are the choices. IV fluids is right, but it's not the first line. Large bore cannula into the second intercostal space is for pneumothorax and hemothorax. On chest drain also is for pneumothorax, for hemothorax, and we don't need this one. And the patient need if the patient has severe blood loss, blood transfusions, we must consider blood transfusion also. But in cardiac tamponade, the first 9 will be single most appropriate management will be pericardiocentesis, and we will explain it. This question clearly points towards cardiac tamponade. The trachea is central. Thus, tension pneumothorax is less likely. Muffled heart sounds, distended neck veins, and hypotension are called Beck's Triad and are a clinical finding in cardiac tamponade. We must note this point when the question is saying that the patient has muffled heart sounds and the patient's neck vein is distended and the patient has also hypotension. We must think about cardiac tamponade. Thank you for your attention.